Okay. So once again, good morning. Today we'll be going through writing results and discussion section of a manuscript. Going back, we started from the start question. We talked about how to write introduction section, how important methodology is. At this stage, it's presupposed that you have done your research, you've concluded the research you intend to do. The next stage is how to communicate what you find from your study to the research community, to the world, to the global community, on what your results, what's the objective you set for your study, what came out of it. So you want to communicate it to the global world. And as Prof will always say, there's an ABCD of research, of manuscript writing, and if you do not follow it in that format, you will not communicate appropriately. So this is to help us communicate appropriately our findings. So the objective of this training is to understand how to present the resource section and how to do it appropriately. So when you are presenting research results, you are referring back to your objective. Remember that when we talk about your methodology, you must have set out an objective for your study, and your objective is derivable from your research question. So your results should also correlate. So when you are writing manuscripts, there is an interconnection between all the aspects of your writing. Your introduction will put to pay your research question. Your methodology should be appropriate to answer that question, and you must have set out your objective. And when you are not writing your results should reflect the answer to the question you start with. Then your discussion is explaining your findings to the global community with respect to what you've done. So all aspects of your manuscript writing are interrelated, and when you are writing, you should always look back to be sure that each aspect is communicating with the other, is connected to the other. One aspect should not stand alone. Now, the results start with describing the variables of interest. What are the variables you looked at in your study? What are the independent variables? What are the dependent variables? What are the confounders in your study? And what were the things you find? Then you want to see how these variables interrelate. That's the next thing you are supposed to do in your results section. How does your dependent variable interact with your independent variable? I'm making an assumption that I understand what these terms mean, because I'm sure we've talked about them in the past, but just to emphasize, your dependent variable is also your outcome variable, while your independent variable is your exposure when you're talking about observational study, or your predictor when you're doing inferential statistics and all the like. So your outcome, your dependent variable, is what you are looking at for. That's what your objective, what you're trying to look for in the study. While the independent variable are the things you think are influencing those things. So after you've stated a description of what the different variables are in your study in the first paragraph or the first two paragraphs, the confounders, the independent and dependent variable, the next step is for you to describe the association between these two variables. Are they associated or are they not associated? Then the next step is for you to do an inferential analysis of this of your finding. That's your regression analysis. So it's a stepwise thing. You start from telling us what the descriptive variables are of the description of your variables. In the first paragraph is when you are telling us, these are the characteristics of the two arms of the study, whether there is a single difference between the variables you study, especially when you are doing comparative study. You want to be sure that you're not comparing apple to oranges. The two things you are comparing are comparable before you start the comparison, before you now start telling us whether association exists or not. Of course, the results section, and again, when you are going to write, when you start writing manuscript, it's important for you to have an understanding of the journal for which you want to submit your manuscript. Some actually say that the process of writing a manuscript starts from selecting the journal you want to submit to. You should actually familiarize yourself with the journal you want to submit your abstract to, your manuscript too before you start writing. The reason is that different journals, yes, the framework is the same for all journals, but the different journals have their specificity in terms of how you're going to write it. For example, the word count varies for different journals, so you need to know what the journal you are writing to, what their specification is. You must know that writing, there is something called writing in the Hemmings way. Hemmings, Hemming ways. Hemming is a renowned writer in the 18th or 19th century. Conciseness of writing is as important as what you write. Scientists do not have the time. Scientists have a lot of things in their hands, so you don't need to be verbose when you're writing. Each word you write in your research should convey a message. So if you are putting a word in your writing and if you remove it, the message is still being passed, then that word is actually not necessary. So again, while we talk about writing in a concise way, the result is actually the shortest part of the writing, because what you're doing in result is you're just stating your findings. You're not elaborating on it. You're just stating it the way it is. And each paragraph should speak to an outcome, like I've mentioned earlier. And when you carry out your study and you find out something not one of your objectives, don't get distracted about it and start telling us, oh, this is the finding you find there, and going into details of those other findings. The focus should be on what you intend to write. Some would say when you're paragraphing your results, you should pick each of your objective and write about it. So that way you know what you're writing in your results section. So each paragraph talks to an outcome. But if you have an outcome that is interrelated, you can actually combine two outcomes within the same paragraph. But it must be clear that each of those outcomes are being discussed in this paragraph. But if you want to pick it one after the other, it's fine. So each paragraph can be to one finding. Yeah, I've spoken to this, that you must only report on what your study objective states from your methodology session. Problem I usually find when I review this dissertation for Part 2 resident and many of our younger colleagues, you don't have to have tables for all your objectives. Yes, you may have one figure talking to one objective, another table, but to have 10 tables in a dissertation is far too many. 5 tables is enough to capture whatever you want to capture, or maybe one or two figures to add to it. So you don't need to put a lot of tables in your write-up. 2-3 tables should do, but at most 5 tables should do. Again, your journal will oftentimes specify what they want. Then a table is a communication on its own. When you have your table, what I often tell people is, when you have a table, cover the other aspects of your study, of your write of a manuscript, and read the table alone. Can the table on its own explain the message you are trying to pass? If that table cannot pass that message, then you need to retweak that table to ensure that it's passing the message it intends to pass. So a table should be a standalone, it should be able to be read alone. So when you are reporting your results, you usually report in prose and in figures and table. And of course, when we say figures are every other non-prose aspect of your results. So your picture, your bar charts, histogram, all form of representation you have in your study, in your research work, is your figures, and they must be attractive, or appealing to your reader. You don't want to put a table that is so crowded, a figure that is so crowded that does not pass a message, or a table that is so long and is so monotonous that persons looking at it cannot actually catch or pick the message you're trying to pass across. So scientific writing is both science and art. There's an art to science writing, and that's why you improve with every manuscript you write. If I write a manuscript today, the next one I'm writing the next day should be an improvement of what I've done before, because it's a craft that you learn, and you increasingly improve on it over time. Now, these slides will be shared to you, and I'm sure you'll be able to go through this. But the message this slide is telling you is that it's not all figures and tables. It's not all figures that can be used to describe all the illustration you want to do. There are those that are appropriate for one another. For example, if you are making a comparison between a categorical variable, a bar chart or a bar graph is what you are going to use. If you are describing a phenomenon, like I want to show that I did like one paper that that has been approved for publication now, one paper I did on acute pneumovolemic transfusion for a Jehovah's Witness. I want to communicate that I'm able to do blood conservative surgery for a patient with Jehovah's Witness. I'm probably not going to communicate that with a table or draw a bar chart. What I needed to do is a picture. So I took a picture of how I did the acute pneumovolemic transfusion and put it in the manuscript. So somebody looking at that manuscript will know what exactly I did. And that's the beauty of figures when you are writing. If I want to show a trend, okay, what's the trend of student publication over the years in University of Medicine on those states? I'm going to probably use a line diagram. Oh, in 2001, only 2 of them published. In 2010, only 5 of them published. In 2015, 1 of them published. There's a drop. In 2024, we have about 10 of them published. So that shows the trend over time. So what you do there is a line diagram. If I want to compare 2 continuous variables, I want to compare height and weight. What I'll be looking at there is a scatter diagram that will show how the relationship between those 2 variables relate. So let's go on. We'll see some of them as we go on. So let's talk about tables. There are rules to tables, and in fact, in some textbooks, a chapter of those textbooks is describing tables, how you write, how you do an appropriate table. There are rules of thumb in writing tables. Many of you must have seen tables in which you see many horizontal lines and many vertical lines. That is not how to draw a table for the purpose of manuscript writing. Your tables should have 3 lines running the full width of the table. I mean, all completely. I think there is a picture depicting it. So, can my cursor be seen? Somebody should confirm that.
Yes, sir.
All right.
Yes,
So, all right. Thank you. So this is 1, 2, 3. This is all you need to draw a table. Yeah, this table is showing this line, double line, and this double line. But you can actually make this single line. At best, what I do is to make this bold, and this single. So these are the 3 most important lines your table must have. For whichever table you are drawing, it must have that line. So, for example, in this table where they want to make a sub-classification, there is a sub-line here, just showing that these 2 are describing the assay scores. So let's go back to the description. I've talked about the table being a standalone and should be appropriately labeled. Then if you are using abbreviations, you must put the definition of the abbreviation in your footnotes. Again, don't put a lot of abbreviations so that it now becomes difficult to understand your table. Clarity is important when you are when you are doing a table. Again, let me mention at this point that when you are labeling your figure, the descriptions come below. Like figure 1, it will be below. When you are labeling a table, the description comes above. You can see this. Table is above. For figure, you see it below. Yeah, I think that's about this. So if you are going to put a description of an abbreviation like MG here, you put the definition, the description in the footnote here. You put a footnote explaining it, and whatever you do, your table should be able to explain in full what it's all about. Now, again, when we are doing table, usually you put your exposure on the row and you put your outcome on the column. So this is the column. This is where your outcome should be, and this is where your exposure should be, where I'm doing a cross tabulation. But there are times in which the number of factors, I mean the number of orders of things you are studying, your number of outcomes are quite so numerous. So you have so many outcomes you are studying, and the table can go long this way. So sometimes you use your initiative to reverse the trend, but normally, as a rule of thumb, your exposure is on the row, your outcome is on the column, but there are times you make a modification and convert like is shown on this table. Again, this is just putting to the things I've mentioned, that you must not be vague in your description. You must be clear in what you are explaining. Now, again, there's something I need to mention. When you put figures in table, your units should be mentioned, maybe in brackets. What units you are using to measure should be mentioned. You don't put units within the table here and put 4 milligram, 4 milligram, 4 milligram. No, you just put the unit here. Also, when you are making comparison, sometimes when you're making comparison and this is not so important and you have 0, 0 in it, if there is no outcome in it, you may not necessarily put that figure. But if you want to emphasize that in your table that this variable did not have any outcome, you may put it there. But if it's not so important, so you can put it up. For example, I'm doing a study and I'm doing social demographic. I put married, widow, divorced. No, don't let me use that. Let me use gender. So I'm using non-binary, forgetting how they use those terms now. But the point I'm making is that if all the gender you have is male, female, and no other forms of gender, you don't need to state and put 0, 0 in it because it's not important. You just put the important one. Line diagrams, I've mentioned, it's used to show trend like is shown here. And you must annotate your line diagram to show what it's all about as is shown in this. Like I mentioned, it's used to show continuous variable, continuous data. And this is bar diagram. Yeah, there are different types of bar diagram. There is horizontal bar diagram and there is vertical bar chart. This is a vertical, this is an horizontal, this is a vertical. The vertical can be composite like you see in this one, in which different groups are grouped together and shown how each bar works. So this group A, how they perform in different of the blue, is this cyan, or what color is this? Then the green, showing what each group does. So by looking at this picture, I can make an inference of what happened within the stock, whether they have in stock, whether it's purchased or sold in group A, B, and C, and D. And that's what it does. So you use bar chart for categorical variable. Never use a bar chart for a continuous variable. It's not going to communicate the message. So again, when you're doing intervals, you probably want to do a vertical bar chart. If you are doing a nominal, you may want to do a horizontal bar chart shown here. So let's talk about pie charts. Pie charts are something that we've been using even right from our secondary school days. It's something so common to us. The essence of using pie chart, which you should understand, is that it is not to make comparison. I mean, to compare two groups. Yeah, there are more advanced way of using pie charts where you can bring in different groups, but essentially you don't use pie charts to make comparison of two groups. What you use it to do is to show what proportion one aspect is taking compared to others. So if you want to show a part of a whole, pie chart is what you use to show it. So I want to show that 1/4. How many people are in the class now? I want to show that 99% of the participants in this fellowship program are in class. I can use a pie chart, so I'll show that majority are around, while only a few are not around. But again, you must be careful when you are using pie charts. Again, this knowledge, this thing comes with experience. So if I have only 0.2% of people absent from class and I use a pie chart, it's going to consume that 0.2 that is going to appear like everybody is present. So you may probably want to use another form of chart to convey that message. But if you want to show 25%, like this chart that is shown here, it's clearly showing what proportion. So by looking at this, I know that the people that came most to class, that appeared most in the NBA championship are others. They are not this category. But if I want to pick a specific group, I'll say Los Angeles and Minneapolis Lakers are the ones that appear most in the championship. So that's the essence of using a pie chart. The pictogram, everybody knows what a pictogram is. And looking at this picture, I can clearly say that 54% of African homes either don't have electricity or have electricity that works occasionally. So by looking at this picture, easily communicate the message that I try to pass. So sometimes we use pictogram, and there are data analytic tools that are used for doing pictograms. We call them data visualization tools like Power BI, different tools that you can use. Even some of your statistical package can also help you to do that. They've skipped my head now, but if it comes to my head, I'm going to make reference to some of the tools you can use to do this data visualization. I've spoken to scatter diagram earlier, where you plot two continuous variables, and when you do this, when you talk about regression analysis, this come into play. It helps you to show how the line of best fit between your two variables, and help you to describe how one relates to the other. I can even help you to predict what the outcome will be if you know what the exposure is. So that's what you use scatter diagram is. And funny enough, in my part one exam, we are presented with a scatter diagram and we are asked to interpret what it is. This is an O&G exam, not a statistical class, but we are asked to interpret it. So some of this knowledge are going to be useful for you even later in your practice when you start going for that. You never can say where it's going to be important. So most journals have specific requests on adjectives, their visuals have made reference to that. Some have limited number of figures. Present your data to enable people planning to do systematic analysis and systematic review and meta-analysis to retrieve and reuse your data. So I usually make this comparison. Your data is what you find from doing your study. You now put your data together to make sense of your data. You present it as a result. So making sense of the data you find from each of your measurements is what your result is. So you are making your data make sense. A raw data does not make sense. If I have a table that has 1,000 columns of variables that have been measured, it doesn't make any sense. I can scroll from today to tomorrow. I won't be able to make any sense of it. But when I summarize that data and present it, that result. So when we now move to the next stage, I'm making sense of my results. That's what your discussion does. Talked about it. So let's move to the next section. But before I go on, let me pick on one or two persons to tell me what message they've gotten from this. So I'll go to the last person on the page. That's Christabel.
Good morning, sir.
Good morning. Tell me one thing you've learned or a question you have to clarify.
Okay, sir. I realized that we don't have to have vertical lines on our tables during manuscript writing.
Beautiful. Thank you very much. Leo, one thing you've learned or something, any perspective you want to put into the discussion? Justin?
Yes, good morning, sir. Again, I learned that the result is basically trying to make sense of your summarized data.
Beautiful. Thank you very much. So it seems I have communicated. Ayorin Oluwaseun.
Good morning, sir.
Good morning. So what you've learned, a question or a perspective that you learned you knew before you want to add to the conversation in terms of writing results?
Yeah, what I've learned is that our results should start with description of variable of interest.
All right, beautiful. Thank you. Then finally, Larry Aderibe.
Yeah, good morning, sir.
Good morning.
Yeah, sorry for
So,
joining it. I learned that the statistical analysis, especially the bar chart, is more inference and you can use to pick out our results from each of the others we tend to use.
all right. Thank you very much. I think we should proceed to discussion. All right. So, like I mentioned, I've already given a summary of what discussion is all about. Discussion is you, like I usually tell people, you've done a research. You are not working in isolation. Your research is a work that is coming up within the context of what has been done before. No matter what you are doing, no matter how novel your work is within a field that is in existence. You are probably not creating a field of your own. So you are bringing something to the table, and when you are writing discussion, I tell people, imagine yourself sitting in the middle of a round table. So there is a round, all this hollow table in which you have center of it. The table is round like you have in ministries where they have meetings. So you are sitting in the middle of known researchers in the world who have worked in this field, all of them seated around you. And you are trying to convince them that this is what you find. You are trying to explain it to them that this is what I find in my own study, which is different from what Christabel found in her own, or which is what's different from what Professor Okpong found in her work, or it's similar to what Aderigbe found in his work. And giving an explanation why the similarity exists or why the difference exists. That is what you are doing. You are trying to situate your work within the context of what has been known before. Trying to tell them, oh, this is new. This has not been found before. This is my own finding. This is different from what others have found, and I can defend it based on this and this. This is why what I've done is better than others have done. Or this is what I'm going to talk about it. This is the strength of my study. This is the limitation of my study. Because no matter how perfect your study is, there's always a limitation. No matter how poor your study is, don't let me say no matter how poor. But for most study, if you design it well, there'll always be a point, because when you are setting your objective, when you are giving your justification, you must have justified why the study is required. So there is always a strength to your study too, and you must present this, because when people are reading your work, they want to, situate what you are reading into understanding the limitation of the work, so that when they're interpreting what you are doing, when they are going to use your finding as in terms of evidence-based medicine, they will situate it within the limitation of your work. So if probably you did your work within the context of a rural area like Irua, where I am, I must state it clearly that this finding is limited to a rural area, so that I won't go and be using it in Lagos, in Lekki, and assume that it's interpretable within that context. So that's what your discussion is. So with this, I think I'll summarize this question. We may not need to go through it, but let's go into the details of it, because there are, like I said, like Prof will always say, there is ABCD of each of the aspects, and let's look at the ABCD. People will tell you that discussion section is one of the hardest to write, because it's in the discussion you actually show the world that you are an expert in this field. It is in discussion that you communicate to your audience that you actually know what this work is all about. That is where you bring your knowledge to play. It is when you put your inferences into your finding, trying to explain out what your result is. So, for example, I find out that tall people often use glasses. So, in my study, I find out that height of more than 1.7 use glasses. Proportion of people that use glasses, or relative risk of using glasses, is 1 point, or let's say relative rate of using glasses for height of more than 1.7 is 2, which implies that they are 200% times more likely to use glasses. So it's when I get to my discussion is where I'll not explain that, people that are tall, they have, this is factual, I'm not an ophthalmologist, so don't pick the message I'm passing, don't take it hook, line, and sinker. I'm just illustrating and cooking up something. So I said, in my finding, people that are tall are likely to use glasses, and this may be due to the fact that their eyeball are usually shorter, so they have short-sightedness and they may need this. And this is similar to the finding that Leo find in JOS in 2013. And so if you not have that knowledge, that background knowledge, you will not be able to do a good discussion. So you must have a good knowledge of the area where you're writing in order to be able to communicate the discussion presently. So your ingenuity, thought concepts are reflected here, your hypotheses are developed, and the content promotes future research. This is from the discussion section. You are going to be able to promote that, further research should be done in this aspect to further validate this hypothesis I'm generating from my discussion. So from a discussion, that is where, if you want to, do further studies in a field, one area you should go to is to go and look at the discussion. That is where the scientists are going to propose, these are possible explanations which you may want to further do a study to validate or invalidate, as the case may be. So the first thing you do when you're writing your discussion section is to give a summary of your finding. Again, you are not repeating what you have in result, because that's what many people do when they do discussion. You don't bring back all your results and come and dump it in your discussion section. Your first paragraph is just to summarize, based on the objective you set out to do, put a summary of what you find in your first paragraph. The next thing is to, again, let me speak to these next two lines, because you may find something contrary in some other lectures that you may have heard. Your strength and limitation of study is the paragraph that should come after the summary of a finding. And why is this important? Before I attended Prof's lecture, in fact, in my part 2 dissertation, my limitation came just before conclusion. And that's why what you see some other people do. But Prof's explanation for why this should be here is what I want to give you. Strength and limitation of study is important to come early in your discussion, because it gives you the opportunity to put this in your mind when you are reading your discussion of the findings. You already know the strength and limitation of the study, so that once you are now reading the other aspects of the discussion, you put that at the back of your mind. If Lawal says that tall people are likely to use glasses, yes, he has mentioned that there's a limitation before, so I will interpret this discussion in the light of the limitation I stated. But if I put all my findings, discuss all my findings initially, then at the end of the day I bring my limitation, then I may not be able to, it may be difficult for me to go back to now relate those limitations to the finding I've discussed. So that's why strength and limitation should come early. And when you go through reporting guidelines, I'm sure Prof told us about reporting guidelines previously. The consult statement, the spirit, the arrive, there are more than 100 reporting guidelines. So for each of those guidelines, you will see that strength and limitation are usually earlier in discussion section. And I think this is the format you should be taking when you're writing. So I've explained what discussion, the meaning of your findings, that's what you do. And again, when you're writing the meaning of your findings, you do it in the context of your objective, in the context of what is stated to find out. It is after you've done this, before you now start talking about things that are surprising finding, discuss your surprising finding, unexpected finding, conclusive result. You must have discussed the main thing. Then at the end of the day, you suggest future research, then you conclude. What should not be in your what are we doing for time? Okay, we still have time. What should not be in your discussion session is bringing back your data or your result. Your result section, like I mentioned, like repeating your result section, then bringing or discussing a result that you've not talked about in your results. Some people do this. What you find in the result is a different thing. Then you now start discussing a different thing from what is in your result. You should not do that. You should not make sweeping statements. So in my study that I did just in area A, I find that tall people use glasses. And now in my discussion, I say that globally, tall people are likely to use glasses. That is not what my study is about. My study is about tall people in area your discussions relate to your target population. You should not make a sweeping statement that is not derivable from your findings should not be done. And you don't start picking things from different areas just to make your discussion bulky, things that are not related to what you are doing. You should not do that. Then some people do this. Your study, describe A, and when you're not concluding, you're not making a conclusion that is totally not related to what your study is. Yes, it may be plausible. Your conclusion may be plausible, it will make sense. I'm trying to bring up an example here to explain what this is. So I did a study that shows that eating of say junks. Okay, let's say eating of gala. Let's say my study is on gala and abdominal fat. And I said in my conclusion, and I said eating of all form of junks will result in increase in abdominal fat. Meanwhile, what I focus on in my study is just use of gala or sausage roll and abdominal fat. So bringing all form of gala, all form of junks to my conclusion is not supported by my data. So you must not bring into conclusion what is not supported by your data. Your data must inform. So like I mentioned at the start of the conversation, everything in your study must interrelate. Yeah, I've discussed this, link the findings together. I don't treat findings as though they are independent of each other. Yeah. Your conclusion restates the most important findings. I've talked about this. Highlight the significance of your study and state direction. Do not introduce new arguments. Do not introduce new data. Do not fail to include the answer to research question. Yes, this is very important. I see some funny write-up. You have a research question at the start of a study, which prompted you, which is the justification for you to start the study. And when you are concluding, you are silent completing on the question you intended to answer. So the question is, if you cannot conclude on your question, what's the essence of the study? So when you cover the other aspect of your work and read your conclusion, you must ask yourself, does this conclusion answer the exact question I started with? If it does not, then you need to rephrase that conclusion. Then you must state your major finding. In conclusion, discussion is what makes your paper quoted. So if your paper will be quoted, is the quality of your discussion that you give that will determine how well quoted your question will be. Your understanding of the study findings results in new hypotheses and propositions. So this is one of the two reasons your research is quoted. The most powerful reason for your research is quoted this is one of the two reasons your research is quoted, and the most powerful reasons your manuscript remains quoted for many years. So if you go to seminar papers and you see them being quoted 100 times, 1,000 times, because of the quality of discussion that has been done. Your discussion must tell a story. I've mentioned this earlier. You are telling a story to the world, and you must do it in a concurrent way. Each paragraph must be interrelated with the other. So there must be continuity of your flow of thoughts from each of the paragraphs you are bringing in your discussion. Your discussion should be reflective of your study design. You cannot be doing let's say just a cross-sectional study and be making inference on causality. That does not exist. So you cannot be discussing that this result in causes this from a cross-sectional study. So your description, your study, like I mentioned, everything must just interact and interconnect all aspects of your study. We mentioned earlier, your discussion should give a new direction to the reader. And when I want to, come up with a new study, sometimes I just go to the discussion of a study I've read and see what they've highlighted as future research direction. Thank you for listening, and we entertain question and conversation going forward. I'm sure Prof will go through the slide, and also if there are things to add or correct from what I've mentioned, she's going to pass the message across. One other thing I want to mention is when you are doing your discussion, there are sometimes, especially for beginners, you find it difficult to interlink your different sections. There are tools you can use to do that. I'm going to share that in the group. There is a Manchester phrase book that gives you phrases that are used to connect each of your paragraphs together so that they flow together. When you are doing your discussion, this phrase book is very important to help you link your thoughts together. All right, so by show of hands, I would pick questions and comments so that we. All right, sorry, this thing's covering. Okay, Miracle, you can unmute and ask your question.
Okay, good morning. Thank you very much for.
All right.
So my question is the result section.
Yes, sir.
If you are actually using a table and the table cannot be contained in a page and the table has to break, how do you label the subsequent table?
Okay, if I get you right, you said if you have a table and the table extends
beyond a page, that is, a page cannot contain the contents of
yes.
the table.
Yeah.
It has to break. So can table break in a study? If it can, how do you label the subsequent one? Or would they have the same label?
Yes, I get your point. Yeah. Usually we will not want a table to break, but again, there are times where a table have to get, especially when you are doing systematic review, where you need to put the different studies or scoping reviews, where you need to put the different study in a table, it can break. So what you just do is you put the label, the initial label, the caption as it should be, then you just put continued in the next aspect of the table.
Okay, thank you very much. Then the next question is, you made a comment, you said that you cannot get a cause-effect relationship in a cross-sectional study.
Yeah, okay.
So
you cannot talk about causality in a cross-sectional study because for as part of the characteristics of what's it called? Cross-sectional study, you are taking the exposure and the outcome at the same time. So you cannot say whether it's the geese before is the egg before the chicken or the chicken before the egg. You are checking the two at the same time. So you can't really say which one comes first, which one results in which one. Yes, if you stretch it, I don't want to confuse you, but if you read further, actually, there are ways in which you cannot make a conclusive thing about it, but you can infer causality within the context of a cross-sectional study. But in general terms, we say that you can't make causality with a cross-sectional study because you can't state which one occurs first between the egg and which one comes first between the egg and the chicken. So that's why you can't make causality, because you are checking the two at the same time. I don't want to go so deep so that I don't confuse you. But in general terms, you don't make causality with that. But when you read deeper into cross-sectional study, there are means or there are ways where you can infer causality even within the context of a cross-sectional study.
Okay, thank you very much. Lastly, if you want to make recommendations, we didn't talk about that. If you want to make recommendations, maybe for further studies, what's the base? Are you going to be recommended based on the limitation you're unable to overcome, or the gap you felt like it's not filled? So what's the basis of the recommendation for subsequent study?
All right, okay, just answer the question. So your question is the two are actually what you use to make a recommendation. So the first important thing is that you remember you mentioned some limitations in your study. So you can be recommending that further study should, expand it. You also made some findings in your study, and when you are doing literature review, when you are doing your introduction, you mentioned a gap which you try to fill. So based on your finding, if you think the finding of the study is valid enough, you can make a recommendation that, going forward, this should be considered. Usually, practice does not change with a single study, but a collation, a systematic review of different studies can come together to inform practice changes. So you can make a recommendation that, maybe in the future, they should look forward to changing practice from this, what is being done based on this finding, to this. Scientists are conservatives. you don't say going forward, because like my part two study was on using vaginal cleansing with antiseptic agents to prevent wound sepsis. Yeah, I found something significant. I cannot say based on my study going forward everybody should be cleansing vagina with antiseptic agents, but I can say this can be considered for prevention of this. That was my recommendation. That's one of my recommendations. Now, when a collection of different studies like this come together, people do systematic review, it can now inform guidelines and say, oh, going forward, this is what you should be doing. And funny enough, or coincidentally, about a year after I concluded my study, there was a WHO release. We recommended that vaginal cleansing with my antiseptic agent should be done going forward. So I didn't publish my study at that time, so it didn't inform it, but I'm sure different studies have been done informed that. So your recommendation, you are talking about what should be done going forward based on the gap you identify in your research question, what should be done to improve your study. Those are the things your condition will cover. I hope that answers your question.
Yes, sir. Thank you very much.
All right. Thank you. Larry.
Good morning, sir. Thank you. I have a question, and I want to ask, when discussing, is it necessary to talk about the sampling bias? And how can we eliminate that if probability exists?
Yeah. If I get your question right, you're asking if when you are doing your discussion, you should talk about sampling bias and how do you eliminate it. You ask two important questions, two independent questions. So when you are doing your discussion, and you think there is a form of bias in your study, those are things you'll be highlighting in your what's it called? In your limitation. So you should highlight it if you think there's any form of bias. If you are doing a systematic review, that's where you bring in all your your risk of bias scores and talk about them, talk about how reliable your findings are. So definitely you should talk about any form of bias, not just sampling bias, but any form of bias that you have in your study. Now, how do you eliminate sampling bias? First, let me understand, what do you understand by sampling bias so that we're communicating the same thing? Are you there, Larry? Okay, let me just explain for another. So sampling bias is essentially a bias that arises from, because you're picking from a population, your target population, a sample, a subset of the population to represent the whole population. You want to be sure that that subset you pick to represent the whole population is actually a good representation of the whole population. So using a probability sampling is a means of reducing sampling bias. So the method of reducing your sampling bias goes to your methodology, not necessarily in your discussion. The way you select your sample from the whole population, so doing a probability sampling helps you to reduce sampling so that your sample is a good representation of the whole population you are studying. And that's different from selection bias. That's why I asked you to be sure what you are referring to. Selection bias is if you are comparing two groups, you want to be sure that you did not inadvertently or purposely select a group so that A is likely to have a positive outcome compared to B, and at the end of the day you have a positive result. You want to be sure that that's what randomization actually does for you, to help you ensure that A is not significantly different from B in terms of other parameters apart from the exposure you are measuring. So if I want to, for example, I want to compare people within the class now. and I want to make a comparison in terms of gender. No, let me use gender. I want to make a comparison between yes, I want to make a comparison between gender. Let me use gender in terms of knowledge, medical knowledge. So I want to be sure that by the time I'm selecting the two comparisons between the two gender, the only difference between the two groups is that gender and not any other factors. That's what selection bias is trying to correct. For example, if I select 2 males in 600 level and I select 2 females in 400 level, and now compare the two in terms of knowledge of medicine, and at the end of the day, I say males are more knowledgeable than female, there's a selection bias already in my comparison, because there are other factors that differentiate the two groups beyond the exposure that I'm trying to study. So that's what randomization helps you to do. Another form of, if you are doing observational study, your propensity score matching will help you to, try to balance that, and other form of correction of selection bias. I hope that explains it. I hope I didn't make it too complex.
Yes, sir.
All right, thank you very much. So any other question? Okay, Grace. Grace, please speak louder. I can barely hear you.
Good morning, sir.
Good morning.
Yes, sir. So please, I wanted you to kindly re-explain the scatter diagram. I didn't get the concept well.
Okay.
Like the
All right.
explanation. Thank you, sir.
Okay, I'll go back to it. Okay. All right. Okay. Any other questions that I think I should just, if there may be related questions that I don't go back and forth. Any other one? All right, so that's the last question, sure. All right, so this is the scatter diagram. So let me go a little deeper into it. So I want to compare the relationship between height and weight in a group of people. So I measure the height of, I want to compare the relation between height and weight of the participant of this class. So I measure everybody's height, I measure everybody's weight. I can put it in a table. So in that place, I'll list the number of people in the class. 1, 2, 3, 4, MWH001 to MWH020, and put their height, their weight, and I'll give you the table. I look at the table, but that does not pass a message to you. You just be looking at, Christabel is this tall, but this is weight. You can't really make a sense of it, of what the relationship between their height and weight is. Another thing I can do is still using a table. I can list the variables, the data of the height and weight in that table. I can decide to plot a graph of their height against the weight. So by doing that, look at this diagram now. This is using eruption duration. I don't know what eruption is referring to here, but imagine this is weight, which I understand. Imagine this is height, this is weight. So for somebody that's weighing 2 kg, so let's say Sarah is weighing 2 kg, her height is this. Nasir is weighing 4 kg, is weighing 2.5 kg. This is height. Who else now? Leo is weighing this is weight. So you plot everybody's weight against their height. So to give you a scatter diagram, you just have a diagram, a point dot along it. So when you have that, you can use the statistical package to do that. You can use statistics to draw a line of best fit along this scatter diagram. You can see a pattern that it follows. For example, first, you can see whether there is a correlation. Does the height and weight move in the same direction? So like in this one now, there's a strong positive correlation. So with each height, there is increasing weight. So we can see there is a positive correlation, and you can see the direction. This one, there is a weak positive correlation. Yes, it's increased, but not at the same rate. This is a negative correlation in which for each height, there's for every tall height, there is a small weight. So that's the essence of scatter diagram. And in this one, there is no relationship at all. So with this, let's say for example, let me use this now. So let's say there is a new person that comes into the class now. I can say if the height is this point, I can say this is what the weight will be. So that's what scatter diagram helps you to do. When you start learning regression analysis, you understand better how all of this comes into place. This correlation will give you your R, which is the strength of your correlation. It tells you the magnitude and direction of your relationship between the two numerical variables, how the two of them are related. Then when you do your regression analysis, you give you your R square. So you can use it to predict what the future will be, or you can use it to predict the effect of change. So if this changes from this point to this point, what will be the effect on your Y variable? But in essence, the important thing to know is that your scatter diagram is showing you the relation between two numerical variables. Does that make it clearer or make it more complex? Are you there?
Sir. Thank you, sir.
All right. Okay. So we just have 3 minutes more to. Any other question, clarification? Let me pick somebody that has not spoken to. Just tell me one thing. Okay, Taufikat. Just tell me one thing you learned from this class. You have 3 minutes.
Good morning, sir.
Good morning.
Yeah, I heard that. I learned that for the data visualization, you can use tools like Power BI to make the data more understandable and easier to understand.
Yes. Okay. I'm still trying to remember other ones. Does anybody knows of other ones? It just keeps my head as I'm speaking. There are many ones. Data visualization tools. Even R can help you for data visualization.
Is it
Tableau?
Tableau?
God bless you. Yeah, Tableau. Tableau is one of it. Yeah. All right. Let me pick on somebody that has not spoken again. Henry, one thing you've learned. Henry, are you there? Okay. Yeah, your network is poor. Don't bother.
Yes, sir. Good morning. From the class.
I'll give Emmanuel the last. Emmanuel, one thing you learned.
I learned that your discussion is what makes your paper quoted.
All right. Lastly, we still have 1 minute. Farouk. Farouk, I can barely hear you.
Yes, sir. Can you hear me, sir?
Yes, I can hear you now.
Okay, I learned that you should not conclude with data that are not part of your work.
Okay.
Your conclusion should be.
Okay, thank you. Yeah, on top of the hour, Vanessa.
Hello, sir.
Yeah.
Hello,
What
can
did
you hear
you
me?
learn?
Can you hear me, sir?
Yes, I can hear you. Go ahead. Mention one thing you learned.
Hello, sir.